around September last year, I realized I couldn't smell, which was strange. But then I thought, okay, maybe I just have a cold, you know, it's just a passing thing. And then I realized October came and I still couldn't smell. So that's when I went to the doctor, and he immediately sent me for a CT scan and referred me to an ENT specialist.
She has a fairly unusual problem. It's this allergic fungal sinusitis. And it's a problem that people get, usually people in the South have it because there's a lot more mold and fungus and high humidity there.
Usually how people have a sinus drip, which may seem common to most people. My sinuses, the mucus was building up within my sinus, but it wouldn't drip. It was just building and building. Because I'm allergic to fungus and mold, then it started to develop mold and it got an infection. And gross. But that's it in a nutshell.
What happens is that they develop sinusitis. Mold starts to grow in the sinuses, and if they're allergic to the mold, they start producing this very thick, tenacious mucus, and the mucus gets trapped in the sinuses. And when it does that, it has nowhere to go, and it starts to expand, and it basically eat away or erode the bone around the sinus.
The buildup was immense, and it had a lot of pressure on my face and on my bones, and the best way forward was to have surgery.
In her case, one of the sinuses way in the back of her head, called the sphenoid sinus, which is a sinus that's surrounded by a lot of very important structures, like your carotid arteries are back there, your optic nerves, your brain, your pituitary gland. There's a lot of stuff back there. And in her case, the bone completely was eroded all around that sphenoid sinus, so there was no bone between this sinusitis problem and all of those structures, including the brain. So Dr. Clark, who was their ENT doctor in Barbados, knew that this was a problem. He actually tried to do some surgery on her earlier this year, and he realized after several hours that he wasn't really able and wasn't equipped to be able to really clean everything out of there that he needed.
In August, I started to have severe headaches, and I got a really bad sinus infection, so I had another CT scan, and that scan revealed that the sinus in my head was blocked and that the bone around it started to erode. Now, in order to clear that sinus is a very technical procedure, and in Dr. Clark's professional opinion, he felt that someone with more experience and someone with access to better equipment, better technology would be the best person to perform the surgery. So he recommended Dr. Tami.
We're really very happy to see Nikita up here. First of all, Dr. Clark, who's her ear, nose, and throat doctor in Barbados, is someone who I've known for the last 10 or 15 years. When I was at the university, he would come up every couple of years and spend a couple of weeks just trying to improve his skills and learn the latest technology. And so he's a very good ENT doctor. When he had this problem with Nikita, that's why he referred him up to me, because he knew that I had the technology and the skills to do that.
Health is important, and for me, my health is important, so if that's what needed to be done, I was fine having it done.
The surgery she had was basically a sphenoidotomy and ethmoidectomy. It's the same surgeries that we do for most people with chronic sinusitis. What made it different is that here at Good Samaritan Hospital, we have an image guidance system, which is the only similar system in the entire city. It's a system that is made by Medtronics. It's an electromagnetic system, and basically what we can do is get a special CAT scan of her, which is just a special X-ray, upload that CAT scan data, which is computer data, into a computer we have in the operating room. And then while she's asleep, we put a little thing on her forehead and we calibrate her to the computer so that as I'm doing the surgery, I can take various instruments and touch it anywhere I want in the sinuses and look up on the screen. There's a little crosshair and it just tells you exactly where the tip of your instrument is, so that you can be aggressive and get all the stuff out of there, yet you can do it very safely, and you can realize that you're getting close to the optic nerve, or you're back in an area where you shouldn't be. And that's the type of technology that, while nothing is foolproof, it really allows you to do this sort of surgery with a lot more confidence and much more safely than you'd be able to do it in an area where you didn't have that availability. Nikita herself was just one of the most pleasant people. She came up with her mother, and we did their surgery the day before their surgery. Her father and sister also came, and similarly, they were just delightful people, very happy to be here, very appreciative of the care that they received. The Cincinnati Sinus Institute is part of Group Health Associates, which is part of TriHealth, and we have two physicians here. We're both primarily high-level sinus surgeons. We manage run-of-the-mill sinus problems, but also the very complex sinus problems. When people need revision surgery, when people have complex sinus problems, similar to this patient from Barbados, or if there are unusual tumors of the skull base or the roof of the sinuses, spinal fluid leaks, things that are just outside the ordinary, those are the sorts of problems that are referred here. And we manage those patients on a daily basis. We do all of our surgery at Good Samaritan Hospital simply because Good Samaritan has the latest technology, and they're able to provide everything we need to do the things that we do.